I'm Nancy Clark.
And I'm Emery Wallace-Phillips.
We're the Hospice and Bereavement Coordinators with VO in Oxford, and this is Morning Chats with Anne-Marie and Nancy.
We're going to continue about common grief reactions in children. Concentration is a huge one. Many times children will have difficulties concentrating, which could result in a decline in academic performance. They may appear to be daydreaming or off in their own little world, but their concentration is so hard to do because of their experiences.
Mm-hmm.
Yeah.
Personal care is another common reaction in grief that we see changes.
Yeah.
So this can be changing in their eating or sleeping habits, difficulty falling and staying asleep, increased nightmares, and changes in appearance and personal hygiene. So some parents will let us know that their child has had some regression when it comes to personal changes or bedwetting at night. That's a very common reaction to grief.
Another personal care, talking about sleeping patterns, sometimes we have parents who say, you know, my children, they never slept with me and now they're coming into our bed for comfort. So that's another, change that could happen.
Mm-hmm. So physical symptoms that have never cropped up before may be very apparent after a child has lost a loved one. So complaining of physical symptoms that might mirror those of the person who has died. Stomach aches and headaches, very common complaints for little ones. And chronic conditions might be aggravated due to stress. So something they may have been struggling with or a lifelong illness, it definitely might flare up during this time of grief and stress.
Absolutely. Mm-hmm. And as we know from our previous morning chats, grief is physical as well. So children also experience these physical symptoms.
Definitely.
Yeah. Emotional shock is another reaction. At times an apparent lack of feeling may develop. This serves to help the child detach from the pain of the moment.
Mm-hmm. So it might appear that there's a lack of emotion, but really it's just the body's normal and natural way of preserving that child. Regressive behaviors, so we kind of touched on this a little bit earlier, but needing to be rocked to sleep or held, difficulty separating from the surviving parent, needing help sleeping, so choosing to sleep in their surviving parent's bed with them for those cuddles. And an apparent difficulty completing tasks that are well within their ability or their scope, tying up their shoes, getting dressed, things like that.
Mm-hmm. Perhaps a child was, using a cup and then reverts back to a bottle or a sippy cup.
Right.
Or perhaps the child gave up a soother a long time ago and then now all of a sudden needs the soother again.
Or a special blanket,
Absolutely.
teddies, things like that.
Yeah.
The death of a loved one obviously can significantly shake a child's sense of security and a sense of structure in their life. Some children do revert back to all of those behaviors we talked about before that they have outgrown or that they have not done in a very long time. So as parents and caregivers, it's very important to refrain from shaming them for taking on these behaviors. Rather, support them and introduce them to new self-soothing experiences that might be more helpful for them.
Mm-hmm. Another common grief reaction, we call it explosive emotions and acting out behaviors. This really reflects the child's internal feelings of anger, fear, terror, frustration, and hopelessness. Acting out may reflect insecurities and a way to seek control over a situation for which they have absolutely little or no control over. So even as adults, it can be incredibly difficult to verbalize our thoughts and emotions. So think of the 3-year-old who has experienced the death of a loved one. Their vocabulary is just developing. They at times don't have the words to describe how they're feeling, hence it comes out in behavior. Think about how frustrating this is for a child. And a child might not, as I said, have the language or the emotional literacy to articulate how they are feeling. Or they may not want to.
Yeah, absolutely. So asking the same questions repeatedly, a behavior that might be really overwhelming for a parent, especially if they're asking things that are frustrating or upsetting. And just for parents, know that it's not because they don't understand the facts, but rather because this information is so hard for them to believe or to accept that they may ask for those details over and over and over again.
Absolutely.
What did grandma look like? What did grandpa do did he hurt himself? Is that why he's gone? Those types of questions.
And remember, children need, or they use short doses of grief. So these questions are just their way of trying to process everything in short spurts. Emotions. There is a wide range of emotions that children and adults, but children experience. Sadness, anger, irritability, guilt, anxiety, happiness, insecurities, fears, abandonment, worry, and shame. I want to touch a little bit on shame. Not only are they maybe shameful of their feelings, but depending on the death of the loved one and the circumstances of the death of the loved one, they may feel shamed by how that person died, or the shame of the parents or caregivers and loved ones may run down to the child.
So a few other emotions that are very common in children: yearning and longing to see the person who has died, sense of helplessness, powerlessness, numbness, relief for a loved one who might have been really, really ill, or who kind of the attention and focus of the family was on that loved one for a long time, turmoil, and etc.
Absolutely.
Yeah, so emotions that just run the whole gamut are very normal for children who are grieving. And we hope that by talking about these common grief reactions, it allows for a caregiver who's trying to support their grieving children to know there's so much that is normal and natural. And although it might be frightening for the caregiver, these are experiences that a child must go through, and we must nurture that.
Absolutely.
So for more information, contact us by phone or email, or visit theoinoxford.ca. And again, don't forget to subscribe to our YouTube channel to view all of our morning chat videos. Thank you.
Thanks for watching.